Hi everyone, my name is Dylan Stevens, and today I'll be presenting to you guys a physical therapy case study. In this situation, the patient, Mr. C, came into the occupational therapy clinic complaining about his right hand, in which he injured 20 years prior to this in a traumatic injury, work-related injury, where he crushed his hand in a crane accident and electrocuted it. This injury resulted in this incident resulted in many injuries such as thoracic outlet syndrome, right ulnar neuropathic carpal tunnel, right frozen shoulder, and lymphedema, which is a skin condition. When the occupational therapist assessed Mr. C, he had symptoms such as stiffness, tightness, heaviness, and he was feeling a tingling or a pin sensation in his hand. These all hindered his everyday activities such as eating and just things to do with his hand, putting on clothes such as like buttoning up his buttons on his flannels and stuff like that, or his button ups. Um, when they got together and discussed a solution to this, Mr. C insisted that he would like to try a alternative or a complementary medicine. Um, the therapist had no prior knowledge of this, but decided that he would agree to it. So he had to do research, and he researched a book called The Nature Doctor by Alfred Vogel. In this book, it actually advised him to use cabbage leaves and clay mix to draw out the fluids in his hand and to reduce swelling in his hand. Um, After that, they came up with a regime together with the alternative medicine and the regular treatments. And the regime was that Mr. C would apply the clay mix from 11 a.m. to 1 p.m. He would keep it on there for 3 hours a day each day, and then he would remove that and place compression glove on his hand, which would reduce the swelling or help with the swelling. And then after that, he would only remove the compression glove if he was to get it wet, or if he was going to swim, or if he was going to take a shower. So after that, then when he was going to bed, he would put the cabbage leaf actually on his right hand and then wrap it with a soft bandage to keep it in place and keep that overnight. And then the next day, wake up and he could take it off and do the same regime each day. After this, after a little period of time, they saw actual good result. Um, Mr. C had an increased motion in his fingers, his wrist, elbow, and shoulder. So there was a lot of positives there. His pain decreased. When he first came in, he complained about a pain about 5 out of 10. And when they were done with the treatment, he said that his pain was about a 3 out of 10. So that's a positive. He had 100% improved condition. Well, not 100%, but his skin condition did improve. So the lymphedema went away a little bit, which was a plus also. So after doing this study, this was one of the first studies actually that was done with this, so there's not much evidence, but it reveals that they need to do further research because they're not sure actually what is in the cabbage and the clay mix that is helping his hand out and working the magic, I guess you would say. Um, so after this, the researchers of this project actually encourage patients to make collaborations with their therapist, and because there can always be positive outcomes. That's about it. Thank you very much, you guys, and you guys have a great day.